Comprehensive Assessment of Altered State of Consciousness, Domain in CHC Assessment. Does the individual have a history of neurological conditions such as epilepsy, transient ischemic attacks, TIA, cerebrovascular accident, CVA or stroke, or vasovagal syncope? If epilepsy is present, what type of seizures do they experience? How frequently do they occur? And how severe are they? What is the usual duration of each seizure? And how long does it take for the individual to recover afterward? Are there any identifiable triggers for seizures, such as stress, sleep deprivation, or flashing lights? Are seizures predictable, or do they occur spontaneously without warning? What interventions are required during or after a seizure? And do carers or medical professionals need to be involved? Does the individual require emergency intervention for seizures, or do they resolve without medical assistance? Is the person prescribed anti-epileptic medication? And if so, what type, dosage, and frequency? Is seizure medication taken on a routine basis, or is it prescribed as needed, PRN? If medication is given as needed, how frequently has it been required in the last month? How effective is the medication in managing seizure activity? And are there any side effects? Have there been any recent medication changes? And if so, what was the reason and the effect? Has the individual experienced any breakthrough seizures despite being on medication? Does the individual have a rescue plan in place for prolonged or severe seizures? And if so, what does it involve? Have they had any episodes of loss of consciousness or altered states of consciousness, ASC? And if so, how often and what is the management plan? Has the person suffered from a stroke, CVA? And if so, what were the effects on their mobility, speech, cognition, and daily functioning? Is there a history of transient ischemic attacks, TIAs? And if so, how often do they occur, and what is their impact? Are there any symptoms before a TIA or stroke, such as dizziness, confusion, or weakness? And how long do they last? What interventions are needed for stroke-related complications, such as rehabilitation, physiotherapy, or specialist input? Is the person at risk of falls due to postural hypotension or vasovagal episodes? And what measures are in place to prevent injury? If vasovagal syncope is present, how often does it occur? And what are the known triggers? Are there warning signs before a vasovagal episode, such as dizziness, nausea, or blurred vision? Does the individual require assistance with positioning, hydration, or other preventive measures to reduce the likelihood of fainting? Is skilled intervention required to manage any of the neurological conditions? And if so, who provides it? And how frequently? Has there been input from a neurologist, stroke specialist, epilepsy nurse, or other healthcare professional in the last 6 months? Are there any ongoing investigations or assessments related to neurological health? Is there a care plan in place to manage neurological conditions? And does it require regular updates based on the individual's condition? Has there been any recent deterioration in neurological status, such as an increase in seizure frequency, worsening stroke symptoms, or more frequent fainting episodes? Does the individual require assistive devices such as a helmet, seizure monitor, or other protective equipment? Have there been any recent hospital admissions or emergency interventions due to neurological complications? How do neurological conditions impact daily activities, mobility, communication, or cognitive function? Is there a risk of aspiration or choking associated with seizures or neurological impairments? Are there behavioral changes associated with neurological conditions, such as aggression, confusion, or emotional instability? Does the individual experience headaches, dizziness, or other neurological symptoms that require ongoing management? Is there an advanced care plan or emergency protocol in place for managing severe neurological events? What documentation is available to support neurological care, such as seizure charts, hospital records, care plans, medication records, and specialist assessments? Please share your thoughts in the comment section below.